Hi, my name's Alison Fitzsimons. I'm the General Manager and Head of Professions for Clinical Support CSC here at Portsmouth Hospitals NHS Trust. The motivation for me around the healthcare leadership model was that we recognised within our organisation that we really required a tool to enable the staff who are in leadership positions to be able to develop their leadership skills significantly. And we felt once seeing the tool and working with the tool that was probably the right method to use. We'd used previous tools for 360 and there have been a number of iterations of this over the years, but the healthcare leadership model that we're currently using at the moment as our 360 tool is by far the most developed and I think is much more user-friendly for a number of different people in the organisation, whereas perhaps where previous tools and models that we've used were very much aimed at some of the very senior staff in the organisation. I think we feel actually this is much more readily available to a number of different people within our organisation who have leadership roles. I think the greatest benefit for the users is that you are getting some really rich, useful feedback about your leadership skills. So you're talking about the areas in which people are excelling, but then also there's some critical feedback in areas which could be seen as development or areas in which to improve. So as I said earlier, anybody in their leadership journey, I believe, would get very valuable feedback from the process. Each of the dimensions in the 360 healthcare leadership model, all of those dimensions are dimensions that I have to put into practice every single day. So it enables me to be able to think very critically about how I'm developing as a leader and the models and behaviours and the values that I'm displaying when I'm at work in every day. Yes, I am doing things differently, and the things that I'm doing is thinking much more about how I project myself at work. I perhaps don't get as involved in as many things as perhaps other people in the organisation would like me to, so I try to put myself forward to take on a few extra responsibilities at work now, and I've developed that probably in the 18 months since I've had my own report and feedback. So yes, but I feel that it's something that I'm constantly working on, and even though I had my feedback about 18 months ago, I find things out about myself when I do other people's feedback and facilitation as well, and I think that's the beauty of the healthcare leadership model. Absolutely, I would recommend the tool to other colleagues. I don't think it matters whether you're at the start, the middle or the end of your leadership journey. The healthcare leadership model and the 360 feedback is a vital part to enabling you to develop your leadership skills, so I would definitely recommend it, yes.